For the longest time, taking a low-dose aspirin, an 81 milligram aspirin, was the standard of care in people who were over 40 to prevent heart attacks. So that means he would not have been the first president taking a low-dose aspirin. He's not the first president to shake a lot of hands. Why didn't we see this with President Obama, President Bush, President Clinton, you name it? It's not typical. No matter how much they say that it's normal, it's not. I believe that there's more.
I want to get to Donald Trump's health condition and to try to figure out what's going on. And we have brought in a doctor who can help us do that. Dr. Frita joins us now. Doctor, thank you. Sorry for going off on the rails a little bit because I started talking about, Donald Trump addressed Gavin Newsom today, and I started watching the comments, and people were going off on Gavin's looks. So there you go. I had to
going off in a good way, right?
Oh my gosh, yes. They were, one of them, just being honest, said Gavin could get it. I'm like, okay, well, there we go. Yeah. Anyways, Dr. Frita is a triple board certified medical doctor with certifications in nephrology, hypertension, and diabetes. She's also the host of the Dr. Frita YouTube channel with nearing 1 million followers and subscribers. So congratulations on that. This is a serious concern. Americans need to know the health of their president. I'm going to play Caroline Levitt, and I want you to hear it, and then I want to get your reaction to what she said, okay?
I know that many in the media have been speculating about bruising on the president's hand and also swelling in the president's legs. Bilateral lower extremity venous Doppler ultrasounds were performed and revealed chronic venous insufficiency, a benign and common condition, particularly in individuals over the age of 70. No signs of heart failure, renal impairment, or systemic illness were identified. Additionally, recent photos of the president have shown minor bruising on the back of his hand. This is consistent with minor soft tissue irritation from frequent handshaking and the use of aspirin, which is taken as part of a standard cardiovascular prevention regimen. This is a well-known and benign side effect of aspirin therapy. And the president remains in excellent health.
What say you, doctor?
The first thing I would think would be congestive heart failure. And I know that they're saying that he doesn't have it, but let's just say, based on appearance, age, and likelihood, 6.7 million Americans have congestive heart failure. And when you have that, it can cause a backup of fluid and give you those swollen ankles, swollen legs like he has. If you have congestive heart failure, the treatment would be to give you a water pill, like a diuretic. Most average Americans will take pills by mouth, but if you're the president and you have access, you could take an IV water pill like Lasix, and what would you use? You would use your veins in your hands, okay? You would have IVs in your hands. Not saying that this is what he's done, but just telling you how my mind is working when I look at his hand. If indeed he is on aspirin, a blood thinner, and he's getting IVs, then that could explain this non-minor bruising. This is pretty significant bruising, but of course that would help his swelling to go down. The other thing that could happen potentially, I don't know for him, I'm not his physician, I would suspect that if you're getting a lot of water pills through the IV, that could cause your kidneys to not work as well, which could also cause you to have a backup of fluid. I am a board certified kidney doctor. I see this every day. He looks pale. A lot of people don't know that as far as your kidneys, they're responsible in a lot of ways for keeping you from being anemic or having low blood. Your kidneys cause your bone marrow to make red blood cells. So if you had any of these situations, then that could cause you to have the pale skin, the swelling in the legs and the ankles, the bruising in the hand that's bad enough to need to have some type of a concealer. My issue is, Don, that in the past, he has not been honest about his health. He's had that one doctor from 2013 to 2018 saying he was the healthiest president ever in the history. He had another doctor prior to that who said he was the healthiest president ever elected. And then that doctor came back and admitted that Donald Trump actually dictated that note. And so he's already given us a history of not being able to trust what he says. So I don't care how many times they stand from the podium and say we're being transparent and they give us information. I'm still using my medical brain, and it's telling me that in this almost 80-year-old man, there's something else going on other than just really common benign conditions. I don't trust it.
Okay, so let's look at it. So look how pale he is here. And I mean, and you can look at, and I don't believe these to be doctored photographs. That's a lot of bronzer or whatever it is. Now let's talk about, we're going to go through all of this. Can you just go back to the hands for me, Andy? Okay. Let's look at the doctor. When you look at this, and what did Caroline Levitt said, that this is aspirin or whatever? I know he's not your patient, but what would you say if you were to look at a patient that had this type of symptom? What would you say the issue is, and how would you, what would you recommend the treatment for them to be?
Okay, so what she was saying, that he's on aspirin, which is a blood thinner, and yes, having a blood thinner is something that could cause some bruising. Typically not this much bruising. And so if I were his doctor and he's having this much bruising, I would say, what else could cause bruising? Liver issues. If you have liver failure, if you're on certain medications that are causing your liver enzymes to be up, if you have hepatitis, if you're taking certain cholesterol medicines, I would check his liver function test and find out why he's bruising so easily. Also, if I were his doctor, I might already know that he's on a high blood thinner. Now, I'm not saying it's about him specifically. I'm just talking about in general. If he were my patient, if he did have congestive heart failure, and if it were severe, then part of that management is a stronger blood thinner than just aspirin, a stronger blood thinner, which could cause a heavy bruising. And if you were my patient, then I would also know that if he's getting IVs in his hand, then maybe he needs to start switching them up and going to the other hand. This is not typical bruising. And if he's getting bruised like this from just a low dose aspirin, then there's still, I would suspect, an underlying problem.
Okay. And so you said that's not typical bruising from an aspirin. What about, it said from, they use the excuse that this is happening from handshakes. And I don't know why that would be happening from handshakes. So you'd think it would be on the other side.
Yeah. It's just not likely. And we already know that he's a germaphobe, so he doesn't love shaking hands. But for the longest time, taking a low dose aspirin, an 81 milligram aspirin, was the standard of care in people who were over 40 to prevent heart attacks. So that means he would not have been the first president taking a low dose aspirin. He's not the first president to shake a lot of hands. Why didn't we see this with President Obama, President Bush, President Clinton, you name it? It's not typical. No matter how much they say that it's normal, it's not. I believe that there's more. Yeah.
Okay. And what would you, if you were a patient, like what would your concern be? I know I told you what's the prognosis, but what would your concern be for this person? Would you tell them to fix their diet? Should they be hospitalized? Should they be monitored often? How often should you see them? How severe would you think this is?
I would just say we need to do a full workup on why you're bruising so easily. And so we would call it a coagulopathy workup, to make sure that there's no leukemia, to make sure he doesn't have low platelets, that he doesn't have poorly functioning platelets. Again, to make sure he doesn't have liver function issues, to make sure that he's not taking a medication that is causing him to do this. Because sure, bruising on the hands, okay, it's not necessarily nice looking or aesthetically pleasing. But if you bruise this easily on your hand, what do you think would happen if you fell and you hit your head? I would be concerned that he's a high risk for a brain bleed if he were to fall. And we have seen him stumble a time or two as he approaches 80 years of age. So I would worry that he has a bleeding disorder and that we need to pay attention and make sure that, hey, maybe he needs a walker or something to ensure that he doesn't fall. If he were a patient, which of course he's not.
Let's put the picture of his ankles up. Okay. And this was the first indication for people. I mean, people saw the hand and they wondered, but then when they saw the ankles, they had to, I guess the White House realized we got to say something. When you see that, what do you think along with the hand?
The first thing I would think, just in seeing this in a vacuum, would be congestive heart failure, kidney failure. Absolutely. Those would be my top two. The congestive heart failure is when your heart does not pump strongly enough to get all the blood and the oxygen forward. And so you get a backup of fluid in the feet, ankles, legs, lungs. Okay. So congestive heart failure can do that. We know that you're at risk for congestive heart failure if you are someone who's older than 70, like of course he is. Also, if you love to have fast food and burgers and you have high cholesterol, you could be at risk as well. He has a history of being a fast food lover, reportedly. The other thing I would think is kidney failure. And again, that's my specialty. If your kidneys aren't working as well to filter out your blood and to make urine, you get a backup of fluid. So that's what I would think in a vacuum if I saw his ankles. Of course, what they've shared is the most benign cause of swollen ankles, which is chronic venous insufficiency. That is not life-threatening. That is very common. And so it's a very safe diagnosis to present to the world without us questioning the health and the virility of the president.
People in the chat are asking about his lips.
What? Now, I don't know about his lips now. Let me see his lips.
I guess they're red and pink or whatever.
Yeah, even as a young man, he's always had these little tight lips. Anytime you watch Saturday Night Live or the people who talk about him, but let's just talk about lips in general. If his lips were to be like blue or really pale or white, then we would think hypoxia or low oxygen or cyanosis. We know that back when he had COVID, even though he walked up and tried to seem strong, when he got out of the hospital and he snatched the mask off, even though we could still see that he was out of breath, we found out later that he had covered up, that he had high fever, that he was on oxygen, and that he had respiratory problems. If he were to have some consistent prolonged issues with his breathing, like some chronic lung disease, then that's something that could cause a cyanosis or a bluish lip. Now, if he has very red lips, then something that could happen. And again, I'm not saying that he has this. I'm just kind of going through the differential diagnosis. Sometimes in patients who have kidney cancer, they actually make a hormone from the kidney, erythropoietin, that causes you to have very high red blood cells, like too many red blood cells, the opposite of anemia. And that can sometimes cause you to have a ruddy complexion, like a red complexion or red lips. Again, I don't know. I'm not his doctor, but just kind of going off of my experience as a doctor, the things that I think when I see his lips. Why he holds them so tightly, that I cannot tell you.
Okay, that could be a number of things, but what about like puffy eyes and the eye bags here?
Oh gosh, puffy eyes. And there's something on my YouTube channel. I literally just released a video on 5 warning signs of kidney disease that can be written all over your face. One of them was puffy eyes. So puffy eyes, swelling around the eyes, periorbital edema. That's something that can happen if you have kidney failure. Okay, if you're not making enough urine and you have a backup. Also, if you leak protein out in your urine, it's normal to have 0 or very little protein in the urine. But if you have some type of a kidney disease and you're leaking out protein, then you can have a backup of fluid and you can get puffy eyes. Clearly, there are other things as well. It could just be aging. He could have allergies. He could be tired. But when you're looking at someone who's looking as pale and as tired as he, with all of that bruising, I would want to make sure I rule out some of the more serious health problems.
Doctor, wow, you have been so informative on this. Did you get to say everything you wanted to say? And I'm sorry I did not get to see that you were in the chat. Did you send us a chat or no this morning?
I did. I was sending a chat. You're like, is there a healthcare provider in the audience? I was like, me. Yes.
I felt like the people, doctor, on the airplane when there's in the back, you know, when someone is like, oh my gosh, it's there. And they go from the back of the plane to the front and they go, is there a healthcare professional on board? And then you know someone is having an issue on the plane. So I wanted to ask because I don't want to diagnose, and I know that he's not your patient, right? But
he's not my patient. If we're taking everything on surface level and we believe what his press secretary says, but then it's the end of discussion. But of course, here in the elimination, we're all thinking people, and if it doesn't seem like it's adding up, it's probably not. And so I'll be anxious to keep watching him. We know he loves to project being strong, tough, strong, masculine, but something in the milk ain't clean. There's more to it.
Let me ask you, can this have any impact on your cognitive abilities?
Oh, absolutely. Absolutely. If you were to have severe congestive heart failure or kidney disease and you were anemic, well, that would mean that you're not getting enough blood flow and oxygen, not only to your different organs in your body that we think of every day, but also you might not be getting a proper blood flow and oxygen to your brain, which could impair your thinking. If you're anemic, you will be very fatigued and not always clear of thought. So yes, this could definitely affect your cognitive ability, your decision making.
The doctor has the Dr. Frita. It's just Dr. Frita. I was going to say Dr. Frita show, but Dr. Frita on YouTube, and she is killing it over there. Over here on the YouTube. So make sure you go and follow her, subscribe to her, and tell your subscribers and followers to come check us out over here on the Elimination. Okay.
Absolutely. Will do.
Thank you. And we'll have you back. We really enjoyed having you.
Thank you. Enjoy being here.
Thank you so much. We delayed a bit. That's Dr. Frita. You guys should check her out. We delayed a bit because we were getting such great information and you guys were asking. And yes, we will have her back. We will have her back.